Okay, hi, Mr. Roselle. I'm going to be your occupational therapist today, and we're going to discuss a little bit about your vision problems that you're having, and we're going to come up with some treatment options for you. So, the goal of occupational therapy and working with clients with visual loss is to maximize the individual's use of your remaining vision in order to be able to be as independent as possible in your basic ADLs. So some of the interventions that we'll be working on in the next few weeks are going to focus on visual skill training, environmental adaptations, magnification, and compensatory strategies such as sensory, auditory, and tactile, as well as organizational strategies. So the first thing we're going to address is mobility. You may be moving slower and having difficulty walking over different terrains, or find yourself bumping into furniture or things in your walking path. So for treatment, we're going to start by walking around the therapy gym, and I will ask you to point out different objects in your pathway, and this is going to help you with paying attention to environmental hazards in your walking path so that you can be safer. The next one's acuity, which is the clearness of your vision. So you're having difficulty reading and trouble recognizing things, so you often squint or blink or rub your eyes. And for treatment, we're going to be performing several different eye exercises where you'll be moving the muscles of your eyes in various motions, including side to side, up and down, and in circular motions. This is technically a workout for your eyes, which will strengthen the muscles and make it stronger, hopefully improving the overall clarity of your vision so you can read your newspaper better. The next one's pupils' reaction to light. So with this, you're having blurred vision, diplopia, which is seeing two images instead of just one. And you have light sensitivity, and you might be seeing halos or starburst. And you have a drooping eyelid and a loss of contrast. So for treatment, we're going to specifically address the drooping of your eyelids by using your affected eye as your only source of vision. So what we're going to do is we're going to force that affected eye to perform double the amount of work for proper vision. So we'll increase focus and movement of the eyelid muscles. It's also going to help a little bit with your double vision experience. And we will do this by covering up the healthy eye with an eye patch or gauze and then doing some therapeutic exercises. The next one is one vision diplopia concerns, which you're experiencing double vision and blurriness, and you mentioned you're having trouble cooking and locating different utensils in the kitchen. So for treatment, we're going to be working in the ADL room, and I will have you working on using your sense of touch to identify objects in the kitchen. And so by working on sensation, this will help compensate for some of the vision loss so that you can continue cooking for your family. The next one is field of vision, visual attention. So with this, you're missing objects, you're bumping into things, you're having neglect, as well as some visual inattention. So for treatment, we're going to be walking around the therapy gym looking for hidden post-it notes, and we're going to see how many of those you can find. So it's going to be kind of like a game, and we'll be working on your visual neglect and improving your overall attention to your surroundings so that you can be safer when you're walking around your home or out in the community. The next one is saccades. So with this, you're having difficulty reading, compensating by extra head movements. You might have some nystagmus, which is vision condition in which the eyes make repetitive, uncontrolled movements, which can result in reduced vision. And you're also having trouble finding things in busy environments, which can be very frustrating. So for treatment, you mentioned that you used to enjoy doing word searches, so I thought we would do a few in treatment. And we will also be putting together a puzzle where you have to locate the puzzle pieces on a table. And then both of these activities will work on finding things in busy environments. The next one is convergence. So you're having trouble reading, headaches, words appear to be jumping out at you. You still have some blurred vision, and your eye drifts when focusing, and also double vision. So for treatment, we will be playing a matching game where you have to match different items together. So for example, in the ADL room, we will be matching a fork with a plate, laundry detergent, with clothing, And this will work on scanning and slowing down to focus on different objects you come in contact with every day. And it'll also make you learn to double check your interpretation of what you do see. Next is range of motion. With this, you're going to have double vision, complain of headaches, trouble focusing, and depth perception problems. So for treatment, I would like to use a flashlight in a dark room and make patterns on the wall. The patterns will go to the left, right, up, down, and diagonally, and you'll have to follow the patterns closely with your eyes, but not move your head. This will help increase your eye muscle strength and hopefully will help alleviate some of the headaches you may be having. Okay, for accommodation, you seem to blink a lot, you have trouble reading, focusing, light sensitivity, and blurred vision. So for treatment, we will be doing something called pencil push-ups, where you hold a pencil out at arm's length in front of you, and you're going to focus on the tip of the pencil, and you'll slowly bring the pencil toward your nose until you're unable to see just one pencil tip. At that point, you will hold the pencil there for 10 seconds or until it becomes clear, and then slowly return to the starting position. This will work on maintaining clear vision when objects change distance. Okay, pursuits. You're having trouble tracking moving visual information, difficulty reading, focusing, light sensitivity, and then once again some blurred vision. So for treatment activity, we will be playing with marbles, and I'll be sitting across from you, and we'll roll marbles to you one at a time. You will have to watch closely, and as it approaches, you will have to trap under your cup the marble. And then we'll grade that activity up by increasing the angles the marbles are rolled, and this will require that your eyes follow a moving object closely. Okay, lastly, for spatial relations, you are having difficulty lining up buttons on your shirt and perceiving the arm is through the neck hole or sleeve. Difficulty pulling out a chair to sit down, unable to locate things in the environment, and you're having trouble with the ability to find your way back from a location. So for treatment, we will be doing a beanbag toss where you have to try and throw the beanbag into a bucket. Then we'll be putting together a puzzle which will help you focus on putting small pieces together to form a whole. These activities are going to help facilitate functional independence and dressing as you learn to focus your attention to detail. So I look forward to working with you on these therapeutic activities to help you regain your functional independence in your daily routines. Thank you.